Anyway, so you talked to the people about
Oh yeah, we were telling them about, or one of our slides. We have a PowerPoint presentation, so one of our slides was just some facts from Haiti that we got from the World Health Organization. One of the facts is that 1 in 8 children under the age of 5 dies before they're age 5.
right.
And so when we said that, when we presented this fact to our local students, we asked them if they knew any children who had died from diarrhea, and they all said no, we don't know anyone who's died from diarrhea. We don't know any children who've died from diarrhea. And we were like, oh, okay, well, do you know children who have died from other causes? And they responded with explaining that there's a spirit called the Lugaroo spirit, and it's basically a witch who comes in the night and kidnaps the children and takes away their spirit, and that's how the children die.
Wow.
So
this is what you're up against. You're trying to...
Right, it's like a very deeply embedded superstition, like it's a very spiritual culture, and what are we supposed to say to that,
Right.
Like, no, you're absolutely not correct. Those children were dying because they drank contaminated water, and they weren't treated, they didn't go to the doctor, they didn't have anything to rehydrate, What are we supposed to say?
So how do you then instruct people and show them the benefit of washing your hands and not defecating and drinking water?
Well, I think that it seemed from the response that we got to the presentation and to some of those slides, like, people were definitely shocked by the figures, and I think that when they hear, these facts are coming from the UN, they do understand that they're researching these facts, and they take them as they go, but it's hard for them, whereas we can associate, okay, these children who are dying, it's because of this. They don't have the technology, they don't have, someone to come and do a biopsy and tell them that this child died from, contaminated water or whatever, so they just kind of assume that it has to do with the spiritual, supersticious. I don't know, it's definitely challenging.
It's going to be a real challenge. Yeah, so not only constructing the toilets, but do they actually do it though? So is there any evidence that shows that children will start using the toilets and start cleaning their hands and
Well, other facts from the World Health Organization and the Center for the CDC in the US, they have figures like washing hands can reduce the risk of diarrhea by 40%. And these are facts that we don't necessarily know exactly how they came to these, but I don't think that they would be sharing these facts with the world. These are very public. These are on all the websites, in all of their pamphlets, in all of their reports, and people are constantly referencing these and using them in programs like this and education programs like this to get the point across that sanitation is a huge issue and that it's something that's preventable. Like, it is something that can be solved by basic simple changes in the way you live your life. And the problem in a country like Haiti is that people don't necessarily have the resources to make those changes. People don't necessarily have money to buy soap or don't have access to clean water. So when they're thirsty, they need to drink water. They can't buy it because they don't have money and they don't have access to anything other than the contaminated well a mile away. It's just not an option for them. And that's what the challenge is. It's saying you need to do this and this and this to improve your lives, but then they say, well, we can't.
Yeah, it's hard. It's not practical.
Yeah.
Okay,
So yeah, it's
objectives
challenging.
to construct.
Well, that took credit pretty well.
Okay. I wonder, you know, I'm like, I got like a million ideas. I'm like, let's just stick to this. The aim of this is to meet wash needs, okay. So I wonder if so overall to decrease, I want to, because the school, the diarrhea, all that is really important to talk about. I want to, like, people know it's important to wash your hands, but I want to throw in somewhere in here that it's going to save lives somehow. Because I know when we do any kind of like grant proposals for like I did grant proposals for like aging research, and people are like, okay, it's great, but you know, vanity, we don't want to look younger for the rest of our lives, of course. But I said, no, you realize aging applies to all of our bodily systems. So if your heart doesn't age as fast, or your brain doesn't age, you're going to live longer, you know. And so one of the things here is to throw in, well, you know, we are going to get these more hygienic toilets, which means just trying to figure out how to throw that into here, is to meet wash needs and leave unsustainable environments sustainable, thus reducing.
I guess my question is like, where should we put it in? Because I don't know that. I don't know if this is the summary. Should we be throwing those facts in here or like into the problem analysis?
I would throw it into the very beginning. So I'm showing the aim of this ecological sanitation program is to meet wash needs and live on schools in a way that is environmental, thus reducing the incidence of waterborne diseases.
Yeah, that's a very like powerful sentence.
So I think that's pretty much, that's good enough. So that's reducing, and then you would need a reference. And, you know, we can't always find a reference, and sometimes you just have to do, like I said, like from our preliminary studies, or
right. But for things like that like the waterborne disease facts are out there.
Yeah, so I'm pretty sure that's out there. And you can also, another phrase, if you can't find a reference, it's always a joke in science. It's like you can say, it is well known that.
Really?
Yeah, you can say
that?
Yeah. It's like such bullshit. Everybody knows. Everybody knows, like, you're either too lazy to look up the reference. I mean, that's not always true, but it's just like, what, you're too lazy to look it up? But if, like, it's well known that washing your hands prevents diseases. And it's better to have a reference, but in case you're, for whatever reason, you're crunched for time, you can just, it's well known that this blah, blah, blah. It's reducing the incidence of waterborne diseases and death.
Let me show. You can see it from right here.
Where were we? So I think that's good to throw that in there. Schools have access to proper, this many students are left to defecate in the remains of this. If you have a way to measure the number of students, you can say an estimated. If you don't know, you can always say, you know, estimated number of students. This needs a reference, I think. And probably dispose fecal matter, pollutes the land, and contaminates groundwater. That would be a reference there. Also, when This would be nice to have a reference.
Okay. I think I can definitely.
Okay, these problems keep children out of school and burden families. See, this, I would be like, how do you know this?
Okay.
And this could be, you know, just from
Other
anecdotal.
countries.
You can also say anecdotal evidence shows.
Okay.
Like, these are all these little catchphrases. There's like, I think I could even download. People like have written them out like as a joke and what they really mean. Like anecdotal evidence. Anecdotal evidence suggests. Sanitary conditions hinder both physical and mental health of children. This, a reference would be good for that. So I think in the original you didn't mention what hands-on is. Let me see, go back to that graph. So here, yeah. I think this is the first time you introduced hands-on.
Okay, and should it be because this is specifically the problem analysis. So should this paragraph be taken down to introduce our goals like to introduce the next? Because I feel like hands-on isn't necessarily, like we're here to address the problem, but as far as like analyzing the problem at the beginning, just because that's important to just let people know why we're here, but then I don't know that this is necessarily the right place to explain the nature of your episodes.
Yeah, because the organization itself is not necessarily important, because this isn't. This can be done outside of hands-on. This is not like a specific thing that benefits hands-on.
Right. But it is important to at least introduce them
since it is involved, you are using the hands-on tool for resources. So problem analysis. Okay, this is good. Okay, yeah. Then this works with the problem analysis. So hands-on disaster response, and then I threw in is a non-governmental organization with the aim of rebuilding disaster sites, something like that.